Welcome to GoodDoctors.Health. Chances are you are here because you're not getting what you need from traditional healthcare, and Google searches haven't solved your problem. Before we dive into what you actually came here for, I want to make you a deal. This video is set up kind of like a podcast, so treat it that way. Pull it up while you're on the treadmill, driving home, or hiding from the people at work in the back office. You know, whatever works. But if you do get something out of this, do me a favor and share it. Deal? Now, if you're anything like me, anything over 3 minutes usually gets the side eye, and a maybe later, that turns into a never. So here's my promise. Within 3 minutes, you'll know if this message was meant for you. But if you do make it to the end, you'll walk away a smarter, clearer, more empowered health consumer. And maybe, just maybe, you'll realize that you finally found what you've been searching for. Sound good? Let's go. So let's just get it out there. You've got questions. Are we what you've been looking for? Can you actually get results? And more importantly, do we get results in a way that doesn't totally hijack your life? These are great questions, and I'm going to do my best to answer them, plus a few you didn't even know you had. People come to us for a lot of reasons. Let's see if any of these are you. A lot of people who come to us, they're having some problems. They've gone to their doctors, but they're getting no answers, or they're getting options that they don't want, like more prescriptions, senseless tests, or just referrals to more and more doctors. People with high cholesterol, blood pressure, and things like diabetes are at the top of this list. Another group is people who have been on these various medications, but they want better options. Either the meds aren't working or the side effects have become a real issue. And since they've already been through the whole gamut of medications, they're now looking for natural solutions. People with anxiety are number one on this list. But we also see a lot of those who have like gut issues or hormone imbalances. And now we are seeing that first wave of those who have been on those diabetic weight loss injections who now have kidney damage that they're coming to us to get reversed. We do have a lot of people who come to us who are very prevention minded. Some because they have a family history of things like heart disease, cancer, Alzheimer's, or obesity, and they don't want that to be their fate. Or they just see real value in preventing problems before they ever have a chance to start. This is the group that knows that genetics are very real, but understands that they're less and less of a factor than we had once believed. We definitely have a percentage of people who have been let down by traditional healthcare. They don't like doctors, but they know they have to do something. COVID really escalated, more like exploded this group. Most of the people who have come to us have been doing extensive online research about their health and the various issues that they're having. But they are getting really confused by all the conflicting information and frustrated by all the trial and error, trying products and programs, but not really knowing if any of it's making any difference. And they just want to know, what do I do? Kathy fit into this group. This woman's kitchen looked like a nutraceutical warehouse. And her husband is actually the one who reached out because he was getting really tired of all the pills that she was trying to shovel down his throat. Using their biodata, we were able to cut down their supplements and their spending by 80%. While simultaneously dramatically improving their lab values. Kathy's cholesterol dropped 40 points. And Bob's joint pain was virtually gone within weeks. A growing number of people are coming to us because they really like the idea of holistic concierge care. But the $10,000 price tag has them pausing. And they want to see what other options are out there. They end up choosing us because we deliver more of what they value at a fraction of the price. Individuals who have very demanding careers and very busy lifestyles understand that they need more than what traditional healthcare can offer. And we are one of the very few places that offers this level of specialized expertise. Lastly, there is a group who's been essentially abandoned by traditional healthcare. And they are coming to us as a last-ditch effort. And we are proud to proclaim ourselves as the patron saints of the last resort. And I'll share some of those miracle stories later on. What all of these people want is to be healthy, so they can have the energy, the clarity, and the stamina for the work they do, the activities that bring them joy, and the people they love. So do any of these resonate with you? Then you're probably in the right place, because you are not alone. There is a mass movement happening of patients, doctors, and nurses who are all leaving this broken health system for something better, because we deserve more than a health system that has more side effects than solutions. So where are you right now? Are you in the category of frustration with all the conflicting information that you're coming across on the internet? Or wondering if you're wasting all this money on supplements and programs? Maybe you are feeling drained and just downright awful sometimes. Or maybe you're at the point where you are starting to feel really concerned. And it's getting scary thinking about what your future holds and where you're going to end up. Our mission at Good Doctors is to meet you where you're at and give you peace of mind, knowing you have solutions that will work. Get back your time and energy that's being siphoned off with fatigue, fear, and all the fact-finding. We want to help you get back to feeling like you again, but the healthier version. The people we work with are the ones who love feeling great, looking great, and running circles around people half their age. And most important, the ability to really dream again, because you are losing hope in an amazing future, ultimately saving you time, money, and adding quality back to your life. How we do this is with 4 key proprietary steps. Let me show you. First, a 30-second background so you know where I am coming from. I'm Dr. Jay Hitson, and I'm the founder of GoodDoctors.Health. I've been a holistic physician for over 25 years. I've worked with thousands of patients on everything from asthma to Alzheimer's. And the biggest shift that I've been seeing over the last couple decades is how dramatically the health industry is being taken over. Corporate hedge funds are buying out private practices. So instead of seeing an independent doctor who is capable of making decisions in your best interests, you're often seeing an employee who's stuck in a profit-first system. Doctors are now bound by this rigid standard of care that's more about liability mitigation than anything else. In the insurance industry, they've cut physician time down to 5 to 7 minutes per visit. Interesting how that's just enough time to either write a prescription or refer out, and not much more. On top of that, so many of the new doctors are in such debt bondage from the outrageous costs of their education, they're powerless to do anything about this. It's really up to those of us, like myself, who do know better. We see what's happening, to be the ones who rise up and reinvent what healthcare should be. So how do we create this transformative healthcare experience? We start by getting a real baseline for where you are at. So whether you're dealing with hormones or inflammation, thyroid issues, anxiety, gut health, high cholesterol, weight issues, fatigue, brain fog, chronic pain, if the answers to these were easy and obvious, you and your Google searches would have found the answers already. Laura came to us completely convinced that hormones were the root of all her issues. She was scrolling the internet far and wide, and all her searches kept landing on her symptoms being the result of a hormone imbalance. But when she got the treatments, did the therapies, and took the supplements, nothing happened. That's because we found out that the root of her problems was really an inflammatory condition that was triggering a hormone imbalance. Making a few simple changes and taking her off of most of her supplements because they were really doing more harm than good. Look at yourself like this glass. You are designed to be full of vitamins, minerals, and nutrients. When you are full, you feel more than just healthy. You feel, well, I like the way scripture says it, fullness of joy. But here's the problem. You do get depleted. There's a lot of things that can deplete you. Stress, bad diets, poor nutrients, poor quality foods, a bad digestive system. Now, when we start to get depleted, we don't immediately get sick. We just feel healthy. We don't feel fullness of joy, but I'm healthy. Very few people do anything about it at this particular stage because you're still doing so much better than everyone else. What is there to complain about? So the problem is if you do nothing, then what eventually happens is you start to get into this range of fatigue. During this phase, people do start to use some compensation measures. They'll get more caffeine, or they'll exercise more, or they'll be diving into energy drinks. The problem is none of those are actually addressing the root cause of the problem, the real depletion, so we continue down, and then we start to see symptoms. Now, this is where a lot of people were getting their attention. This is where you're really doing some serious searching. A lot of individuals are starting to go to their doctors, but at this particular point, you are still only in the symptom phase. You haven't gotten to the point of disease. So when you go to the doctor with all of your symptoms, they will run tests and they'll say, everything is coming back normal. That is because you're still only in the symptom phase. You have to get all the way down here to this level of disease before anything is going to test positive on traditional healthcare's lab work. Now, please do take a second to notice something here. Look how far down in the depletion process you're already at when you are starting to have things that are testing positive. Now, at that point, a lot of individuals end up getting put on medications. Now, do those prescription medications address the root cause, the depletion? No. So then we start to really see the downward health spiral. And it's kind of game over at that point. So what do we do about this? Well, the most important thing is we need to find out what is causing the depletion. Now, it can be external factors like stress. Stress really depletes this system. Stress uses a lot of vitamins, minerals, nutrients, resources to manage that. We wish it burned more calories. It doesn't. It just depletes all your vital nutrients. Another big external factor is poor dieting, doing these very low calorie but also low nutrient food plans. You're not getting the nutrients you need to fuel your life, and you end up. Now, from an internal perspective, a couple examples would be poor digestive system. A lot of individuals have a really bad gut. This can be from so many different factors, from exposure to overly processed foods to overuse of antibiotics or stress depleting the gut microbiome. When the digestive tract is not absorbing, so even if you are intaking the vitamins, minerals, and nutrients, if your digestive system isn't able to absorb them, you end up depleted. Another big one for women, pregnancies radically deplete these systems. I mean, we love our children, but man, do they suck the resources right out of us. And furthermore, when a lot of women go through menopause, that also creates a radical demand on the system, which then causes depletion. So a lot of the women who are going into menopause may be in this range of fatigue and just a few symptoms. Once they hit menopause, whoosh, they feel like the bottom has fallen out. When really what's happening is they were just getting caught when their glass was already half empty. And now they feel like they're really dying. The other incredibly important factor to all of this is understanding this principle. The body prioritizes essential functions over non-essential functions. That means things like your brain, your heart, your liver, your lungs, they get first dibs on all resources. And then the non-essential factors, they get fueled if there's enough left over. So the first depletions that we see when there is a deficit are things like your skin, hair, nails, joints. They're non-essential. You don't need a thick, full, healthy head of hair to survive. And your hair requires a lot of minerals. So in a depleted state, the body siphons minerals away from hair production to go to other more essential functions. Your skin is a huge organ. It takes a lot of resources to maintain gorgeous, healthy, glowing skin. Your joints are a mineral-rich resource. So in a deficit, what your body will do is it will actually pull and siphon minerals from your joints to fuel more essential organ systems. And of course, we'll see fatigue. Going 100 miles per hour requires more fuel. So your body shifts gears and says, no, we're going to go 35 miles per hour to conserve fuel. In a depleted state, the body will start to hold onto fat like a life preserver. And it typically holds it right about there, right in the middle section. Fat is a fantastic fuel source in a depleted state. So when you find yourself in this scenario, it feels like it's virtually impossible to lose weight, no matter what you do. And another big one is this sense of unexplained anxiety. When all of this is going on in the body, there is a sense of distress. Now, 30 years ago, people just labeled that as, I feel a little run down. But nowadays, because of all the media associated around anxiety, instead people are now labeling what they're feeling as anxiety. The worst part about this is, if you go to your doctor and you say you have anxiety, they can't run any labs because there's no labs that measure anxiety. So even if this is your true root cause, now you're in a whole other downward spiral, taking medications that don't solve your problems. Now, when this doesn't get addressed, if you don't figure out how to refuel your system, we end up seeing what I like to call the unhealthy triad. Remember, the body prioritizes essential functions over non-essential functions. So in this deficit, the non-essential organ systems, like your reproductive organs, your gallbladder, and your thyroid, you can live without all of those. They become underserved. And we start seeing all kinds of symptoms associated with these areas. We start to see decreased hormone production. In younger individuals, we see all kinds of reproductive issues, from heavy menstrual cycles to PCOS, endometriosis, and everything in between, including infertility, gallbladder and digestive issues. And in the process, we end up seeing the thyroid getting underfueled and leading to even more problems. The real question is not what should you be doing about your thyroid or your hormones or anything else. The right question is, how do I refuel so that my body can do exactly what it's designed to do, which is heal and thrive. And what you don't want to do is let your tank keep getting more and more depleted, because the lower it goes, the harder it is to turn it back around. And if you let it get past a certain tipping point, well, not everybody can make a full recovery. So if you believe you could be in one of these depleted states, Let me tell you what you need to do. Step 1 is to identify depletions. We do this by getting comprehensive biodata that covers every system so we can find the leaks. The problem that we ran into with the lab work that's covered by insurance, it is so limited. Insurance companies consider it fraud to run proactive and preventative testing on their dime. That's interesting, isn't it? It's almost like they want you to get sick. The very tests that could catch this early aren't allowed. Well, at least not until it's too late and the only solution is a lifelong prescription medication. I do dive deeper into this in my podcast. Go ahead and check it out. We don't play by insurance's rules. By partnering directly with the lab, we get you advanced biomarker testing at a fraction of the cost. No middlemen, no inflated pricing, no waiting for a health crisis, and irreversible damage. This is also why you're not getting results with some of these very well-meaning influencers and all your internet research. Just because something worked for one person doesn't mean it's going to work for you, especially if you don't share the same root cause. And the only way to truly know that root cause without exhaustive trial and error is to get your comprehensive biodata. Here's a few examples of the power of testing. Dan was in his early 60s and was already doing a lot for his health. He had hit this plateau though, and he wanted to see if we could do anything to reignite him towards his goals. Looking at Dan, you would never think anything was wrong. He was seeing great doctors and getting his blood work checked multiple times a year, and everything was mostly normal. We got his biodata back and were shocked. Dan had an advanced metabolic issue that was tearing away at his muscle tissue. He was already showing early signs of liver disease, and everything that we had been seeing with his blood glucose was starting to make sense. Dan required a few key supplements. Within a few months, his numbers had improved by over 75% without the use of any additional medication. We were able to prevent an imminent health crisis that was being completely missed by all his doctors. Dan is now doing and feeling fantastic. He is back on track and making progress towards his goals again. Cindy was having issues with her weight and some low energy, but nothing she considered extreme. She only got her comprehensive biodata done at the prompting of one of her friends that really thought that she might need it. When we got Cindy's numbers back, she had a significant marker for inflammation that was attacking her liver and her kidneys. Her cholesterol was well over 200. Many of her biomarkers were in critical ranges. Cindy needed a few key supplements and some dietary changes that in fact made it an immediate improvement. Within 90 days, her cholesterol is down to 180, her liver and kidneys are in the clear, and her critical inflammatory numbers dropped by 300%. And she couldn't believe how simple and easy it all was. We work together with our patients to help them take full control of their health and guide you towards the life that you want to live. And for those who are ready to make a change, we offer a free 15-minute consultation where you can talk to the doctor about what are the right next steps for you. You can click below on our webpage and schedule that right now. Now, step 2. Did you know that your blood work can actually tell you what foods your body is asking for? And furthermore, which ones it's telling you it'd really prefer you stop? Just like how your doctor can look at your labs and know what medications should be right for you, your biodata can tell you how you need to modify your diet to meet your health goals. Now, not many doctors are trained in the science, and even the ones who are, they have a hard time using it. This takes time, and time is not reimbursed by insurance. That's why you see so many of these natural doctors charging $5,000, $10,000, even $15,000 for this kind of care. I set out to make this level of care accessible for those who aren't ready to invest tens of thousands of dollars. Have you ever seen the movie Pearl Harbor with Ben Affleck? There's a scene where Commander Doolittle, played by Alec Baldwin, is preparing his B-25 bombers for a daring raid on Tokyo. But these planes weren't designed to take off from an aircraft carrier. The runway was too short and the planes were too heavy. At one point, Doolittle looks at his planes and says, "She's a fat lady. She needs to be a skinny lady." And then his team got to work, stripping off everything that was non-essential. Extra gear, non-critical parts, anything that added weight but didn't serve the mission. That's exactly what we've done with GoodDoctors.Health. We stripped away everything that doesn't lead to great results. No paid celebrities talking about us on social media, no unnecessary steps, and no bloated pricing. Just the most effective parts of healthcare, designed to get you answers, solutions, and real progress. It's high value, results-driven care delivered at a fraction of the cost. Point number 3 is supplementation. The key to supplementation is the Goldilocks principle. Not too much, not too little, just what your body's asking for. Supplementation is required in so many cases because you're gonna need something stronger than broccoli in order to reverse some of these numbers. But too much supplementation is detrimental because your gut has a limited number of receptors. You don't want to be absorbing something that you don't need while the thing that you do need passes on by. It is estimated that 80% of the supplementation people are purchasing is either ineffective or just the wrong thing for them. Now, it's very common for people in my industry to find one problem and give you 5 different pills that you need to be taking for that. After so many years of experience, I do the opposite. I find 5 problems that have the same underlying root cause, and I give you the one most potent, powerful solution that can address all 5. It's really more effective that way. It is not uncommon for the people that I work with to be taking less than $50 a month in supplementation. I can do this because I know what works consistently, and I can get you access to the right products. Now, level 4. This is where things get highly personalized. It's called behavior coding. Now, some people only need a few small, simple changes. But for those with very big health objectives and limited time, creating change that feels effortless and automatic can use a little bit more support. That's why we start everyone with their comprehensive biodata and then determine who qualifies for this expanded level of service. We are one of the only groups in the entire country who's able to offer this level of transformation for our patients. Lori was in her 50s and she was falling apart. She was going through menopause, her weight was climbing, her moods were unbearable, and her relationships were suffering. She had an incredibly demanding career in banking, divorced, and had a long and tumultuous relationship with every diet and exercise program you can imagine. Her labs allowed us to deal with her numbers, but what she needed was a complete transformation. We worked with Lori over the course of 90 days and got her from feeling frustrated and fat to vibrant and alive again. She was doing better at work, relationships with her family were back on track, and she felt and looked better than she had in 10 years. Now, our process makes everything simple and we guide you through every step of the way. It all starts with ordering your exploratory panel. That gives us your comprehensive biodata baseline. When we go through your health history, that's where you'll give us all the supplements and medications that you're using. If one of your goals is to reduce the number of pills, please be detailed in what you're taking. You'll receive instructions to go get your blood drawn. Just show up at your favorite LabCorp with your photo ID and they know exactly what to do with you. Your results are automatically uploaded into our system, and within a few days, you'll get notification to schedule your one-on-one consultation. When you meet with the doctor, you will be going through your results line by line. You will be empowered to understand exactly what's going on and what steps make the most sense for you. And you'll walk away with a comprehensive strategy for your health. And from there, we'll help you decide what level of ongoing support makes the most sense for you. Whether you want clarity in a plan or you want to really go deep, we offer flexible options for every step of the journey. Order your panel today. Can you really afford to wait for a health crisis? If your health continues on this path, do you know where you'll be in another 5 to 10 years? If you're already having those warning signs, it is only a matter of time. And if your health is already stealing from you the fullness of joy, it's already costing too much. There are few guarantees in healthcare, but here's what I can promise you. We will get to the root cause of what's going on. We will find solutions that will work for you. And if I can't help you myself, I will find someone who can. It's time to feel 10 years younger. Have energy for everything that you care about. Less anxiety, more happiness. Let's face it, healthy people have more success, better relationships, and more resources to make a difference. If you're still not sure if this is what you need, set up a free 15-minute consultation. But the real first step is to get your exploratory panel done. Order today.